It's a great pleasure to be here today, and I'm really happy to share my story and from my childhood and how I joined Venue. So thank you so much for this platform. I'm the firstborn of in a middle-class family of 2 children. We lived a happy life with my family during my first years of existence until the time things suddenly changed. I was 9 years old and about to enter 3rd grade when the genocide against Tutsis in Rwanda began in 1994, forcing my family and I to flee home. My family and I had to rebuild our lives in 3 different refugee camps in Tanzania. After 3 years in refugee camps, we returned to our beautiful country, Rwanda, but we had to get used to a new life without our beloved father, who was assassinated. It was not the home we remembered. Our mother had to raise 2 children alone in very challenging situations. Nevertheless, my younger brother and I, we knew that we had to get an education. Our mom kept motivating us, saying that if you go to school, if you remain focused, you will become important people, you will be able to serve the community. So after seeing how sick, poor people were dying in crowded, dirty camps, I decided medicine or pharmacy was my calling. In fact, we could have died anytime because of weak health systems, lack of medicines and medical supplies, lack of skilled healthcare providers, and lack of food. My brother remembered the extreme hunger we faced and set his sights on agriculture. Then we said, okay, let's divide and reign. So he followed agriculture, and then for me, I decided to do pharmacy. So my mother nurtured my love for education, hard work, humility, and service to others. I did not have shoes, and I could not afford more than a meal or 2 a day. Despite those adversities, I was always among the best performing students in class, humble and happy to serve others. In grade 6, when I was 15 years old, I was the best performing student in Kibungo, my home province. By the end of the 6-year primary school, I was among the top 10 students in my country. And then our reward was a government-sponsored trip to Switzerland, where I interacted with other children from war-affected countries, as well as other stable and developed countries in Europe. This trip was a life-changing and eye-opening experience. It restored my hope for a bright future, and I got to understand that with hard work, living a life of purpose, humility, collaboration, and service to others, I could reach my full potential despite the bitter past. Years later, I decided pharmacy would be my profession. I wanted people-oriented profession that provides a reward in knowing that I have helped someone who is in need. In fact, I have benefited from the support, humanitarian support from the international community, and I felt that I have that responsibility to give back. Knowing that pharmacy is a vital part of the healthcare system with an ultimate goal of ensuring availability, safe and effective use of medicines for achieving definite outcomes that improve patient quality of life, my passion drove me to study pharmacy at the University of Rwanda and prepared me for such a lifelong commitment. Over the past few years, we know that the role of pharmacists have been evolving to meet the needs of modern healthcare systems and the needs of our populations. I was also inspired by the concept by the World Health Organization, the concept of 8-star pharmacists to cover the roles of modern pharmacists, such as a caregiver, a decision maker, communicator, manager, lifelong learner, teacher, leader, and researcher. Those roles line with my values and reflect my future career goals. I believe that health is a human right. As a pharmacist, manager, leader, supply chain professional, and researcher, I have the moral responsibility to contribute to and advocate for global health equity by fighting social injustice, but also promoting pharmacy workforce development, which is in some settings, it's almost forgotten. My goal is just to join my efforts with other global health practitioners for a better world with robust, resilient, and sustainable health systems, promoting access to healthcare services for all without any discrimination, but also building a strong pharmacy workforce, especially in low-income countries. Further opportunities came my way when I won a one-year fellowship with Global Health Corps, which places young professionals with global health nonprofit organizations. Through this fellowship, I joined Partners in Health in Rwanda, and I was serving as a Global Health Corps fellow, but also serving as a pharmacy supply chain analyst. At the end of the fellowship, I was hired as the pharmacy program manager at Partners in Health in Rwanda, where I developed and managed the pharmacy program in 4 years. I collaborated with the team to create a robust system for monitoring and replenishing health commodities, and mentored young pharmacists from the University of Rwanda to follow in my footsteps. I have contributed to Partners in Health mission of providing a preferential option for the poor in healthcare by ensuring availability and proper use of medicines for rural and vulnerable communities in Rwanda. Working with Partners in Health has attracted my attention to global health delivery through learning from and collaborating with pioneers and other professionals in global health equity. Later on, I transitioned to West Africa to develop the pharmacy program and help strengthen healthcare systems devastated by Ebola outbreak, that is in Liberia. And I'm still serving as the pharmacy department lead at Partners in Health in Liberia, where we contribute to capacity building. We are building the capacity of the pharmacy workforce in Liberia, but also serving our patients to make sure, to ensure safe and effective use of essential health commodities. My work experience in Liberia has allowed me to interact with and share experiences and learn from global health practitioners from diverse backgrounds, witness more challenges in global health delivery, and expand my career aspirations. Further opportunities came my way when I was admitted to Harvard University to pursue my grad school in a Master of Medical Science in Global Health Delivery. And I was lucky to interact with different people with diverse backgrounds. And then that's how I came across Tammy, and I learned about Venue Foundation. I was very excited because it was my first time to learn about an organization that is really focusing on pharmacy workforce development. I knew about other associations of pharmacists or pharmaceutical societies advocating for pharmacy workforce development, etc. But Venue is unique. That's how I was really excited, and I said, this is the best organization to work with. Thank you.